All right, next presenter is Laura Sedano, who's a doctoral candidate at Virginia Tech and medical family therapy fellow. It's a lot of words. I thought I messed up. At the Family Medicine Residency Program at St. Mary's Hospital in Brain Injection, Colorado. Her topic is this: clinician as patient, the gift of illness. Please welcome to the stage, Laura Sedano.
7:45 a.m. I was able to find a lab, met with the neurologist, heart surgeon, primary care physician, infectious disease doctor. I called down to the hospital's kitchen to order my Ensure shake, and the nurse who came on duty tells me the plan for the day. Blood pressure medication, baby aspirin, iron is due. The antibiotics have been taken for 4 weeks now, will continue to run. The occupational therapist will come and teach me how to shower. The respiratory therapist will come and check on my ability to breathe. Shortly after, my newly married husband comes in and unloads. You need to know what's going on with the family. It is 3 days after my open heart surgery. But the story began 1 month earlier. Coming back from our honeymoon, I began to shake uncontrollably, had severe headaches and vomiting. I presented to my PCP, the worst headache of my life. I was hospitalized. After a few days of being just discharged, I returned with left upper quadrant pain. Imaging determined that I had 12 septic emboli or mini strokes of my brain, and infarctions, or things that go and cut off the blood flow to the pieces of tissue in your body on my kidneys, liver, feet, and hands. A resident who came to do a physical exam asked, "Has anybody ever told you you had a heart murmur?" And echo revealed that there was a vegetation on my heart valve. I had infective endocarditis, and the open heart surgery replaced the valve and antibiotics. So I'm sharing my story because clinician as patient is an interesting spot to be, and if I could choose my guess, as that patient is not one application to which we would immediately submit. But just as we have gifts from our most challenging cases, there are also gifts of illness. And the gifts that I received hit home on 2 levels. 1, Laura as a family therapist, and 2, Laura as the clinician. And more so, the human being, newlywed, and the patient. I hope that you will also consider those on those levels: 1, your role as patient advocate, and 2, in your role as potential patient. So, first gift that I received. Our tough conversations are secondary prevention. I started going downhill 7 days after our wedding, and specialists said the bacteria were growing in my body for 6 months. Andre, my husband, and I had to discuss the implications for having a tissue valve versus a mechanical valve, his caretaking should I have brain damage, and overall medical decisions. And many couples may never have to go through that. Nonetheless, everybody experiences existential trials. So in your own way, inquire to your patients about their ideas about caretaking should one get sick, and have an open conversation about that. And as a patient, don't wait until your wedding day, or that you trade in your wedding gown for a hospital gown to have these conversations. Next gift is that transparency empowers. The race against time was the issue. Going to surgery too early, my brain would bleed. Going to too late, and my heart would fail. And the doctors presented the statistics. So I want you to educate your patient on likely outcomes, but balance it like the risk and benefits, as that is a challenge. Also, a challenge of balance, or a challenge of it is balancing transparency and instilling hope. So I pushed the date back for my surgery in hopes of my chances of my brain bleeding out would decrease. My heart surgeon came in after he heard my hesitation and said, "You were my daughter, I would tell her to go in, and sometimes you just need to take a leap of faith." This aspect did not involve statistics. Instead, it highlighted that medicine needs to be complemented with humanity. The next gift is that the system trumps the individual. Family is central to care. After I was discharged from the hospital, it felt to the chaos of my newly married husband wanting to take care of me, and my mother feeling that she knew best. And this reminds me of an article published in the LA Times titled How Not to Say the Wrong Thing. It was on the ring theory. So the patient's placed in the middle, and those closest to the patient can only dump out, complain and cry. Those furthest can comfort in. In the hospital, my family and husband were jockeying for position. Who can dump out and who can only provide comfort? So according to the state of New York, Andre was my next of kin. But according to 26 years of my life, my mother was out of court. And so pulling together a family meeting, whether it be with or without me, the patient would have been crucial to flesh out these issues. So treat the patient without the family at the patient's peril, at your own peril. The next gift is that amplify the patient's voice. This is the fantastic family medicine team who delivered my care. And they wore red. This is taken the day of my surgery, and they wore red as a sign of solidarity. And there's a point in my care where a covering physician gave me a shot of blood thinner without consulting them or my EHR. And my objections that it was contraindicated due to a risk of hemorrhaging were dismissed in the shot given. When I again expressed my concern the next day, he threw his hand up at me and walked out of the room, never accepting culpability for his medical error and the risk he put me at. So as a patient, project a strong voice, clinical team, amplify that voice. The next gift is that work-life balance. Family-life balance is not a concept that should be taken lightly, but a dictum that should be shared by all. I once was a student athlete, playing volleyball at D1, D2 level. I completed my master's and almost got my doctorate. I'm grateful I didn't go into heart failure and or my brain didn't bleed out. I'm glad I did not become that 1% statistic of those open heart surgery patients who died on the table. It's easy to take your health and your loved ones for granted, and incorporating gratitude in our own life is something that we can do more often than we think. I do not assume that I'm the only one here who's been touched by illness, experienced, and known it. But I hope that you join me in practicing these gifts. You do not need an illness to implement these in your own life and your own work. So transparency empowers. Difficult conversations are secondary prevention. The system trumps the individual. Amplify that patient's voice and enjoy your health and your loved ones. Thank you.